If you're over 60 and stopped masturbating because you thought it's not for your age, stop right there. That belief might slowly hurt your health, your mood, and your intimacy. Today, you'll get clear and safe guidance, plus a private bonus practice at the end of this video. I'm Dr. Yvonne Goldstein, a urologist with over 30 years of experience treating men after 60. My goal today? To uncover the truth about masturbation after 60 and how it can actually support your sexual health, your mental clarity, and your sense of connection. Stopping masturbation can do harm. It can cause erectile issues, loneliness, even depression. You'll hear 6 science-based truths to help you break free from shame and rebuild confidence. Step-by-step guidance, clear, simple, with safety tips included. And yes, a discreet 3-step bonus at the end. Still here? Good. Let's begin. Part 1. Why stopping masturbation after 60 might be a mistake. I've lived 65 decent years, but now, if I touch myself, it just feels wrong. That's what Frank, a retired engineer from Ohio, told me on his first visit. After his wife passed away, he stopped masturbating altogether. Not because he lost desire, but because he believed. At this age, it's meaningless, maybe even shameful. Frank's not alone. Many men over 60 quietly carry the same belief, and slowly, they lose their spark. They feel like strangers inside their own body. But here's what I want to make very clear. If you stop masturbating just out of shame, it might be a mistake. Why? Because it can cut off your emotional connection with your own body, make you feel insecure, avoid closeness, cause non-medical ED simply from lack of touch over time. The fix isn't complicated. Here's a starting point. Step 1. Ask yourself privately, why did I stop? Step 2. Let your body feel again, without saying sorry. Step 3. Try touching yourself with respect, not judgment. You might feel lighter, calmer, more you. That first step can help you reconnect with yourself. Have you ever told yourself to stop? What made you do it? If you're still watching, drop a in the comments, just so I know you're still here. Part 2. I've seen this in thousands of men like you. Is something wrong with me, Doc? Or is it just me? That question, I've heard more times than I can count. I'm Dr. Ivan Goldstein, a urologist who's worked with thousands of men aged 60 to over 80. ED, low desire, burnout. I've walked beside men just like you. And from all those years, I've learned one thing for sure. Your relationship with your body and your sexuality does not end at 60. It just moves into a new phase, where presence, acceptance, and self-care matter more than ever. This isn't theory. These are real stories from real men in real clinics. So if you've ever felt unsure, confused by the changes, please know this. You are not broken. You are not alone. Take a deep breath. Let's keep going. We're about to see how quitting the practice can lead to loneliness and disconnection. Part 3. You stop to be disciplined, but end up feeling empty. Why? I thought I was being disciplined, but I ended up isolating myself. That's what Raymond, 72, shared. After nearly a year without touching himself, he believed it was the right thing to do. But over time, the nights grew longer, his mood got lower, and his sense of connection to his own body slowly disappeared. Sound familiar? Many men after 60 stop masturbating in the name of discipline. But here's what often happens instead. ED gets worse because the tissue isn't being stimulated. A deep feeling of loneliness from emotional disconnection. Mild signs of depression, poor sleep, low interest, pulling away from others. You don't need to change everything today. Just try this. Write down how you feel each day. Mood, sleep, connection. After 2 weeks, ask, has quitting made me feel better? If the answer is no, then it might be time to start again, but safely. Do you see yourself in this? If you do, stay with me, because the next part gives you a clear path back. No shame, no extremes. Part 4. No more guessing. Here's your step-by-step plan. I tried starting again, but I didn't know where to begin. Luis, 68, told me that. After years of disconnection, he wanted his strength back. But the more he searched, the more confused he got. Too much info, not enough clear guidance. Sound familiar? When it comes to masturbation after 60, most men fall into one of 2 traps. Either they ban it completely, or they go overboard, without realizing it. No roadmap, no balance. This video gives you a 6-step path, based on 3 key pillars. Physical. Keep blood flowing. Protect the structure of erectile tissue. Support healthy response. Emotional. Let go of shame. Rebuild confidence. Reduce anxiety and confusion. Intimacy. Understand your own needs. Reconnect honestly with a partner or just with yourself. Each step comes with a simple practice dash, plus a clear safety warning to keep things healthy and balanced. I'm not asking you to rush. I'm inviting you to take a closer look, based on science, not shame. Do you prefer clear steps? Then stay close, because we're about to begin with the most important part. Releasing shame, the silent blocker. Part 5. A silent mistake most men don't even notice. Have you ever thought, I'm too old to care about this anymore? Bernard, 72, used to think that way. And because of it, he missed something important. Before we dive into the first core truth, I want you to pause for just a few seconds to check for one small, quiet habit that causes big harm. The habit of silently believing your time has passed and ignoring your body's needs. This mistake slowly eats away your confidence, pushes you further from your partner, and makes it hard to even look at yourself in the mirror. We'll break this down in the next section and show how to fix it safely. Still with me? If what I've said makes sense, type 1 so I know you're here. If not yet convinced, type 0. I want to do better. Up next, truth number 1. Releasing shame. Healing quietly. Part 6. Truth number 1. Shame is a silent destroyer. I feel wrong for even thinking about it. That's what Robert, 68, whispered to me, like a confession. No one ever told him this. Shame doesn't heal. It destroys. At this age, most men don't stop masturbating because they lose desire. They stop because they believe they shouldn't. That belief cuts the emotional connection. It weakens self-trust, and sometimes causes erectile problems, even in a healthy body. You don't need to fight yourself. Try these 3 simple steps. Name the shame. I'm not wrong for having desire. Allow touch as an act of respect, not guilt. Write down how you feel after each time. You might feel calmer, lighter. Robert tried this consistently, and later told me, "I feel alive again." Note: if you've experienced past sexual trauma, please work with a therapist. XT. Nice, 2020. Are you judging yourself lately? If you see yourself in this type period, so I know you're still here. Next. Truth number 2. Masturbation isn't loneliness. It's self-awareness. Part 7. Truth number 2. Masturbation does not equal loneliness. It's self-awareness. I only do it when I feel too lonely. That's what James, 66, believed for years, until he changed how he saw it. Masturbation is not a sign of failure or isolation. It's a form of self-care. It's your right to feel, to connect with yourself, especially after 60. You can restart gently. Shift your mindset. This is care, not escape. Focus on feeling, not judgment. Your body still responds. Notice small wins, better sleep, more calm, a sense of enoughness. Repeat this truth. I still have value. I still have feelings. Many of my patients, once they dropped the guilt, slept better, and felt confident again within just weeks. Note: immune system benefits are still under study. If insomnia persists, consider seeing a doctor. EXT. NIH. 2021. Do you feel differently now, seeing this in a new light? Next, we'll talk about blood flow and why use it or lose it is a biological truth. Part 8. Truth number 3. Erections follow the rule. Use it or lose it. Harold, 72, said to me, "I'm not sick, but I can't get hard like I used to. What's wrong, doc?" I just smiled and said, "Nothing's wrong. You just haven't used it in a while." Erections are all about blood circulation. As we age, blood vessels narrow. The heart pumps a bit slower, and if you don't keep stimulating the area, the erectile tissue misses out on oxygen. Function drops, even without any disease. You can begin simply. Encourage blood flow weekly. Gentle touch, no pressure. Track changes, how long it takes. Firmness, sense of control. Be patient. Think of this as maintenance, not magic. Harold gave it a try. 2 months later, he said, "I'm not 25 again, but I feel in control again." Note: ED can be an early sign of heart disease. Don't self-medicate. EXT. AUA. 2020. NIH. 2022. Have you exercised lately? Even once a week is a great start. Coming up next, imagination. Your most powerful sex organ isn't down there. It's in your brain. Part 9. Truth number 4. Porn is optional. Imagination is essential. When I asked Phil, 68, about his habits, he quietly said, "I can't feel anything unless I'm watching porn, but I feel guilty when I do." He's not the only one. Many older men confuse porn with healthy arousal. Your brain is your strongest sexual organ. But if you rely too much on outside images, like porn, your sensory system gets dulled over time. Eventually, real bodies feel less exciting. Not because of age, but because your brain gets rewired. Here's a better way. Don't cut it cold. Try 5 minutes of intentional imagination each week. Close your eyes. Recall feelings, sounds, breathing rhythms that used to move you. Write down one positive imagined scene, and use it to retrain your inner response. Note: if you feel out of control with porn use or feel shame afterward, consider seeking professional support. XT, WHO, 2019. Have you tried just 5 minutes? No screen? Coming up next. Frequency. How often is just right for you? Type 1 if you've ever tried mindful imagination. Part 10. Truth number 5. Consistency matters more than frequency. Do I really have to do this every week, Doc? I'm just too tired. I've heard that question from men over 60 at least 100 times. John, 73, used to think if he couldn't do it often, he might as well stop completely. But he was wrong. There's no golden number. What matters is finding a steady rhythm, one that fits your body and lifestyle. Try this. Choose a reasonable pace, once a week or twice a month. Both are fine. Set a soft schedule, like relaxing Thursdays, no pressure. Quick journal. Your mood, sleep, erection quality, and satisfaction. Think of it like a pleasure wellness practice. Not intense, just consistent. Your body adapts fast. If you go too long without stimulation, it resets to numb as the new normal. Gentle warning: if you notice pelvic pain, a new curve in your erection, or blood in your urine, stop and see a doctor. EXT, a UA, 2020. What pace feels right for you? Write down your soft schedule tonight. Next, I'll show you how masturbation can become a bridge to deeper intimacy with your partner. Part 11. Truth number 6. Masturbation can lead to deeper intimacy. I'm not attractive anymore. My wife must be bored of me. That's what Rick, 68, whispered during our first session. But once he began listening to his body again, something changed. He communicated better with his wife and felt more connected. Masturbation isn't the opposite of intimacy. It's a doorway into it. When you understand what feels good for you, you can express it clearly, without pressure or confusion. Here's a simple practice. After each solo session, write down one positive feeling. Try an easy opener with your partner. The other day, I noticed I really enjoyed when, in intimacy, focus on feeling, breath, and eye contact, not just performance. Intimacy in later life doesn't need to be fiery. It just needs to be honest and present. Gentle note: if you feel pain during sex, dryness, or a prolonged erection, get it checked. You may need a water-based lubricant. XT, a UA, 2020. Have you ever clearly expressed what you enjoy? Try starting with just one simple sentence today. Next, a small practical gift. Your 3-step safe start guide. Bonus, the 3-step safe start routine. I promise not to leave you empty-handed. If you're ready to start again, gently, no pressure. Here's a 3-step routine made for men over 60. Step 1, environment. Choose a quiet, warm, private space. If needed, prepare a water-based lubricant to reduce friction and increase comfort. EXT, a UA, 2020. Step 2, breathing. Inhale for 4 seconds. Exhale for 6. Repeat for 2 minutes. Long breaths calm your body, reduce stress, and reconnect you to feeling. Step 3, reflection. Afterward, write 3 short lines about how you felt. Note one thing you'd like to try again or adjust next time. Safety reminders. Stop if you feel pain, chest pressure, or discomfort. If you're taking nitrates or blood pressure meds, never combine with ED pills. EXT, NIH, 2022. Have unmanaged heart disease? Talk to your doctor before increasing sexual activity. EXT, NIH, 2021. Can you set a gentle 10-minute reminder tonight to try this? This is your circle, completed. You now have a roadmap, clear, safe, and designed for your pace. If you've made it this far, you've already opened a door inside yourself. Let me close with 3 core pillars every man over 60 should remember. Physical. Erections aren't just about arousal. They reflect blood flow and well-trained erectile tissue. ED can be an early sign of heart disease. Get full-body checkups, not just down there. XT, AUA, 2020. Mental. Letting go of shame doesn't mean letting go of values. It means saying, I still feel, I still deserve. Healthy imagination supports natural, deeper arousal. EXT, WHO, 2019. Habit. There's no right number of times. What matters is a gentle rhythm that fits your life, even 1 note a week. How do I feel today? What do I need? Can help you course correct and reconnect. If this video meant something to you, please subscribe, turn on the bell. And don't miss more honest talks about men's health, aging, and intimacy. Type 1 if it was helpful. Type 0 if not. I read every response to improve. Medical disclaimer. This content is for educational purposes only. If you experience pain, bleeding, sudden ED, depression, or any serious symptoms, please reach out to a doctor or health provider. EXT, CDC, 2023. EXT, NHS, 2023. You are not past your prime. You're standing at a new kind of peak, where every sensation, every connection, can mean more than ever before. Take a deep breath, smile gently, and choose one small step today. Where will you begin? Type 1 if you're still here and still with me.